Hello, good evening. My name is Sarah. I'm here to present to you Vericella virus. Vericella virus is one of the 8 herpes viruses that infect humans. Herpes virus leads to chickenpox. The virus establishes its roots in dorsal root ganglia and is common among mammals. The mode of transmission for the virus is by direct contact with the vesicular fluid or respiratory droplet infection. The maturation period is 10 to 21 days, and the virus is infectious within 48 hours before the rash appears until the vesicle cross is over. The incubation period for Vericella virus is 14 to 16 days. The client will present with mild fever and malaise 1 to 2 days before the rash onset in adult. The first virus resurfaces as shingles or herpes zoster. After decades of the virus being dormant, the virus can reactivate, leading to painful blistering, unilateral rash involving one of the 3 adjacent dermatomes. Initially, the rash is erythematous and maculopapular, forms blister for several days, and is crushed. It takes 2 to 4 weeks for a resolution to occur. However, the post-hepatic pain can persist for a significant period. The virus can be transmitted to newborn, causing neonatal varicella infection, especially if the virus is active in the last week of pregnancy. Herpes virus can induce persistent infection, and how it remains indifferent in the infected person, it's different. There are 2 types of herpes virus, type 1 and type 2. The varicella virus, also known as chickenpox, is highly contagious rash illness transmitted by inhalation of saliva. I think I have said that before. So during the exposure to the varicella zoster virus, the virus replicates in the upper respiratory tract, in the tonsils and the epithelial T cells, leading to a subclinical cells associated with viremia. During the viremia, the virus disseminated to a reticuloendothelial tissue such as the liver and the spleen. The virus appears on the skin and mucous membrane. The second phase occurs 14 days after infection. The rash is mainly in the trunk with small pruritic maculopapular vesicles that spread to the neck and the limbs. After about 12 to 72 hours, the lesion can turn into abscesses that break, leaving scars on the patient's skin. Epidemiology of the virus. Vericella is a worldwide infectious disease caused by Vericella virus zoster. The virus remains latent in the nervous system, reactivates years after infection, and causes complex neurological disorders depending on the host immunity. 4 to 7 women of every 10,000 pregnant women are diagnosed with varicella zoster virus, leading to congenital varicella syndrome. Before the introduction of vaccination, the virus was common, and with low immunization, the virus became most widespread rash illness in Italy. In the early 90s, the United States had about 4 million varicella zoster virus cases, 1,600 cases per 100,000 people, 11,000 instances of up to 13,000 hospitalization, and 100 to 150 deaths per year in 1995 in the US. Between 2000 and 2010, the number of cases dropped by 79% due to introduction of vaccination. In 2012, With the introduction of the second vaccination dosage, the rate dropped to 93% and the death rate dropped to 90%, attributed to the adherence to vaccine policy. Maternal risk of varicella virus include pneumonia, scars, muzzle hypoplasia, encephalitis. Pneumonia here is repeated, hepatitis, perinatal risk of varicella virus includes fetal demise, stillbirth, intrauterine growth retardation, spontaneous abortion. Infant risk of varicella virus include neurological abnormalities such as microphthalmia, chorioretinitis, cataracts, mental retardation, muzzle hypoplasia, developmental delay, abnormalities of the gastrointestinal. Glaucoma, hepatosplenomegaly, cardiovascular system problem, long-term learning difficulties, developmental problem, and hearing impairments. Patient presentation, the subjective data includes pruritic rash on the trunk, fever, malaise, which looks like the flu symptoms, muscle aches, swollen lymph glands, painful ulcers, tingling sensation. Objective data include rash noted on physical examination. Fluid from blister is used for diagnostic purposes. High temperature, rashes on the face. Serological test is being carried out to confirm diagnosis also, even though diagnosis could be also confirmed by looking at the rashes and seeing the spread of the rashes on the body. Antibody tests can also be used to diagnose. Differential diagnosis for this case is herpes simplex, meningococcemia, pox viruses, disseminated herpes simplex. Please, that's a big word. Okay, diagnostic test is polymerase chain reaction, PCR, vesicular fluid, cross or scrapes, amniotic fluid tested later in pregnancy, rubella culture sample from the nose, or could be taken either blood or urine. Serological testing of the neonate for IgM at birth and IgG at 7 months. Treatment plan. Apart from medication, we could do physiological intervention is to counsel women exposed to varicella virus to test for varicella zoster test and tell the woman about the effect on her infant, such as microphthalmia, chorioretinitis, cataract, mental retardation, muzzle hypoplasia, and developmental delay. Other treatment plans include psychological things that the mother needs to know is about abnormalities of the gastrointestinal, long-term learning difficulties, developmental problems, genitourinary tract, avoid overcrowding areas to minimize exposure to and report symptoms of generalized malaise and flu-like symptoms to the doctor or the nurse practitioner. Medications include symptomatic treatments such as giving Tylenol 650 twice a day to control fever. Also, antivirus medication, Zyclo 400 milligram, can be given 3 times a day. It is used in all stages of pregnancy. Pregnant women at risk of severe disease are given Vericella, a purified human immune globulin within 96 hours of exposure to the virus. Women of reproductive age are assessed for immunity before pregnancy and given the Varivax, a live attenuated vaccine in 2 doses of 4 to 8 weeks apart. Avoid pregnancy for those women that are planning to be pregnant for a minimum of 1 year after the last injection was given. Isolate the client. The rash disappear for about 7 days. Maintain respiratory and contact precaution even when in labor. After delivery, isolate the mother and the baby in a private room. Non-pharmacological intervention include apply cold compress, apply calamine lotion, encourage hydration, take warm bath, encourage the woman to take warm bath, wear cotton clothing, colloidal oatmeal bath soak for about 15 to 20 minutes, give food high in vitamins A, B12, encourage the woman to eat food high in vitamin A, B12, and vitamin E, and amino acid such as green leafy vegetable, red meat, eggs, dairy products, whole grains, legumes, beans, spinach, tomatoes, and orange. Here are my references. Thank you for your kind attention to this presentation. Bye. Have a good evening.